Everyone, we're just going to do a quick video on some new things or reiterating some things with trauma. So the first thing we're talking about is the trauma narrator. So it's still kind of a work in progress, but you guys are doing awesome. You're making some really good changes. So some things we've done to help is we've posted kind of a tip sheet in every single trauma bay that looks like this so that you can quickly look at what you need to chart. The other thing that's really important with the trauma narrator is making sure that you do the trauma audit. So it just gives you a chance to correct anything you may have missed. You can take notes on this thing, we don't care, but this has to be done for every single trauma activation. This has been redone, this is a new version, and again on the back we have kind of those tips to help you document a little bit easier and quickly.
One thing we keep getting some feedback on is taking our patient's temperature. So it's really important for a trauma patient to take their temperature because cold patients don't clot, and bleeding is one of our biggest risks for our trauma patients. So make sure you take your patient's temperature, retake your patient's temperatures throughout their visit, and then of course provide any warming methods. So your room should be really hot. We should do the warm blankets, so we have a nice warmer in here. Use a bear hugger if needed. Of course, we're going into summer. It'll be a little bit less likely that we're going to need the bear hugger, but still, we're getting everybody naked. Sometimes they're wet and their temperatures can get low even in the summer. So make sure to keep them warm and document that we kept them warm.
The other thing we want to talk about is the IL gun. So when you're stocking your rooms, you should be checking your IL gun. So if you see one that flashes red like this, that means that the battery is about to die. So what it normally should function like is you should see the green light. So that means you got a good charged battery. So if you do get that flashing red, let Janine know so that we can order another one.
Yeah, these aren't chargeable. We actually get rid of them, unfortunately. And we are changing up how we're doing our red packet, our red trauma packets. It's going to be a sway. So just look for that, more to come later, but just so everybody knows, if you're going through your trauma certification right now, we will figure out how to meet you wherever best makes sense. If you're very beginning, we'll probably start you on the sway, which is going to have all the same things as the trauma packet. It's just going to be an electronic version, so you don't have to keep track of as many papers.
Be a lot easier.
Thanks, guys.
Thanks.